This is Emily Allen, an MSN Family Nurse Practitioner student. This study is about breast cancer screening rates. I would like to acknowledge Dr. Chris Jordan, my advisor, and Ms. Tanya Mead, my clinical instructor. One out of every 8 American women will develop breast cancer in her life. Breast cancer is the second leading cause of cancer death in women in the United States, with 232,000 women diagnosed with this disease in 2015. The average incidence rate of breast cancer per 100,000 people from 2012 to 2016 was 147.9 for the United States and slightly lower at 142.6 for the state of Arkansas. A screening mammogram is utilized to detect breast cancer at an early stage, which allows for better treatment options and reduced mortality by finding more incidence of the disease while it is still localized and prior to spreading and affecting regional nodes. This supports the practice of providers to encourage all patients to adhere to the recommended mammogram screening guidelines. The United States Preventive Services Task Force recommends that women aged 50 to 74 years old who are not high risk should receive biannual mammogram screenings for breast cancer. The Healthy People 2020 goal for women ages 50 to 74 who have received a mammogram in the last 2 years is 81.1%. Only 72.4% of women in the United States ages 50 to 74 years old are adhering to these screening guidelines. The purpose of this study is to compare the biannual mammogram screening rates of average risk patients aged 50 to 74 in a local clinic in Northeast Arkansas to the national average rate of 72.4% receiving mammogram screenings. IRB approval was obtained through Arkansas State University, and a retrospective chart review was performed for this study. Electronic medical records of 50 patients at a local Northeast Arkansas clinic were reviewed. The dates utilized in the study were January 1st, 2019 through November 18, 2019. A data collection tool was used to gather data. Data collected included age, whether the patient was screened in the office, and if biannual mammogram had been performed. Inclusion criteria were female patients, ages 50 to 74 years old. Exclusion criteria were male patients, any females younger than 50 years old, any female older than 74 years old. If the patient had a current or history of breast cancer, or a first-degree relative with current or history of breast cancer. This study found that the rate of female patients ages 50 to 74 years old at a local clinic in Northeast Arkansas who had received biannual mammogram screenings was 76%. In light of the recommendations by the U.S. Preventive Services Task Force for women ages 50 to 74 years old to receive biannual screening mammograms, this study found that the patients at this clinic had better adherence rates than the United States average, however, still falling below the Healthy People 2020 goal. This leaves room for healthcare providers to address the barriers with some patients or provide a reminder for other patients and further encourage adherence to this guideline. Early detection allows early treatment, which improves the rates of mortality related to breast cancer. This is education that can be provided to our patients. Thank you.